There we are. There it is. So hi, everyone. I'm Dr. Mike Bevilacqua. I'm a nephrologist in Surrey. And thank you for joining us here today for our webinar all about kidney transplant and finding a living donor. We're very happy to have you all here on this Friday afternoon. And we were just talking before we started here. It also happens to be International Women's Day, which is fantastic. As a very big piece of serendipity, we realized literally everyone involved here, aside from myself, you're going to be hearing from. We have a great group of very highly intelligent professionals. We have our group of coordinators, and we have our presenters, every single one of which who is a wonderful woman that we have joining us here today. So it is entirely appropriate that you'll look up and down the panel list here and see such amazing faces. So it's what a great day to have a good session like this. So what a great timing here. The other thing I like to remind people of, even though we all meet virtually here, everyone's sitting in their own little space, it's good for us each to reflect where it is we're coming from, even though those are different parts of the province and perhaps even beyond the province, which is great. Myself, I come from the traditional and the unceded territory of the Katzie, Semiahmoo, Kwantlen, and a few other Coast Salish peoples. And again, if everybody can think and reflect about the history and the value and all the people that have come before and after on the land that they're coming from, it's a great time to do so. So this content for today, to get into it, we're going to be talking about kidney transplant and finding a living donor. Just as a bit of background, in case you're joining for the first time, this is one in a series of webinars. Some of you may have been to previous ones, and if that's the case, welcome back. It's great to see you again. If this is your first one, a little bit of a rundown of how it works. One is that if you go to our website, so if you just put in BC Renal, if you just type that into your Google there, it'll come up, and you'll see that we have a whole section about these patient education webinars. And there you'll find recordings of all of the various sessions we've done before, including this one. Give it about 2 weeks or so, and the recording from today's session will be up there in case you see something that you want to go back and check again and want to rewatch it. There's all kinds of other sections on all kinds of other topics that you can check out. So feel free to browse through and view those. And then if you're interested, in addition to just recording, if you click this subscribe now button, you'll get a little alert when these sessions are coming up live so that you can attend and be able to interact with the live sessions there. If this is your first one, or even for the returning people, just a bit of a reminder of how the sessions work. So very specifically, we've made it so that we can't hear or see you. That's for privacy reasons. We're recording everything. So that's quite intentional. But we do want you to ask questions and be able to get questions in through the session here. So the way that we'll do that is if you go on the Q&A box, and that's the one with the 2 little speech bubbles. If you type your question in, what we'll do is we'll gather them, and when an appropriate time comes in the session, there'll be a few little breaks, we'll bring the question forward then. The one little item I like to make about the questions is that please get your questions in. If it's something that's very specific or very individual to your own situation, we'll probably just, I'll let you know to go and bring those questions back to your individual kidney team, because that's where those one-on-one questions are best. But we'll try to make it shape it into a general question that everybody can benefit from. And the last little part of housekeeping outside of the questions is when you register, there was a little box you could click that says, do you want to let your team know that you attended? That's not that we're keeping attendance or anything like that, but that's really just so they're aware and they can follow up in case you have questions that come out of it. Because that's really the goal of the session here. Today we're going to be talking about all of these various considerations about transplantation, which is done in our kidney clinics too. So the goal here isn't to replace those one-on-one sessions. Actually, that's the most valuable thing, is you having that one-on-one session with your kidney team. The goal here is that we're going to provide some basic overview information so that when you go into those one-on-one sessions, or maybe if you've already had it, it kind of prompts questions and prompts discussions and has you well set up and well informed to talk with your team about it. So it doesn't replace that, and if anything, this is to complement it and enhance that process. And the reason that we like to do this, we've been reminding people that all of this planning and education is really best when done ahead, especially when we're talking about things like transplantation. We know that, and you'll hear about this, but for people who it's an option, transplantation definitely is the preferred treatment. If your kidneys get to the point where they're no longer functioning, people do better, they live longer, they feel better, they're healthier, everything about it is just a better fit if it's an option for you. But it also does take some time to plan and time to get everything in place. And so that's why we really hope that one of our additional goals is that people are starting this process and starting to think about it as early as possible so they're ready to hit the ground running if the time comes. And as I always tell my own patients, the best situation to be in is for you to have thought this all through and never need it. So if you're starting that early that it's not even a consideration, great. That's even the best case. But if it comes to that, best to have thought about it, in advance. Okay, and so that's enough for me. What we're going to do now is introduce the rest of our team here. And you can see we've got a fantastic panel lined up for you. Where we're going to cover the whole spectrum of the process. So we're going to talk about the recipient, so the person receiving the kidney process. And we have Maggie, who's one of our recipient coordinators, as well as Ben, who's actually gone through the process and has lived experience with it. So we're going to hear from the two of them about the recipient experience. We're going to hear from the donor side, our coordinator, Nicole, and our patient, Rima, who are also, same thing, one healthcare provider, one who's lived the experience. And Jody is our social worker. Specifically we call out here because if you're starting to go through this process, you'll see there's a lot of involvement with your kidney clinic social worker and with the transplant social worker. And so we'll get to hear a little bit about that process too. And so with that, I'm going to turn over the screen here to Maggie, and we'll get started into the content of it.
Hi, everyone. My name's Maggie, and I'm one of the kidney pre-transplant coordinators in the recipient office at St. Paul's Hospital in Vancouver. And I'm going to be starting today with part 1. So we're going to be talking about the recipient program to start, who is eligible, what are those transplant options, and what is the process before we speak with Ben. This slide shows you the recent kidney transplant stats in BC. The dark blue bars show the number of total kidney transplants by year, and we did take a bit of an effect from the pandemic for a couple of years, but we're back up to 340 transplants for 2023. Is kidney transplantation the right treatment for you? Benefits of transplant are that you will feel better, you have more energy, you'll have freedom from dialysis, you'll have greater independence and be free to travel, your life expectancy is increased, and you'll enjoy a regular diet. Some of the risks of transplant are that there will be possible complications from the surgical procedure and possible side effects from the medications you take post-transplant, which weaken your immune system and may cause you to be more prone to infections and some cancers. The pre-assessment period is the period before you are approved for transplant. This is when you are referred to our office by your primary nephrologist, preferably when your GFR is around 20 before you start dialysis. Your primary nephrologist and GP will continue to act as your primary caregivers, and a referral does not mean you're on the wait list for transplant yet. You must be assessed and approved first. During the initial workup and for testing, this is completed by your referring center, and this testing may include some blood work, some heart testing, chest x-rays, cancer screening, disease screening, and vaccinations. This testing is standardized for all referrals to us. When your initial workup is completed, you can be booked for a transplant assessment at our clinic, and waiting time for a clinic appointment at St. Paul's will depend on any potential live donors working up for you and anticipated waiting time to transplant. Once you get to our transplant clinic, your assessment will include appointments with our transplant physician, our transplant surgeon, a social worker, one of the pre-transplant nurse coordinators, and any other providers that might be part of your workup. Once all your investigations are completed, they'll be reviewed by the team, and you will be either approved for transplant, declined for transplant, or asked to complete further testing. The length of the process does depend on the types of medical conditions that are unique to you, the tests that are needed, and the availability of the appointments for those tests. What happens once you are approved for transplant? And if you are still pre-dialysis and you have an approved live donor, you will look at scheduling in a surgery after your GFR falls below 15, and that GFR is the test that indicates your kidney function. If you don't have an approved donor, you will be waiting to start dialysis to be eligible to go onto the deceased donor waitlist. Once you are, if you're approved and on dialysis already, if you have a live donor approved, you would proceed to booking an OR for that. Or if you don't have an approved donor, you will be eligible to be listed on the deceased donor waitlist. So for living donation, there are a bunch of benefits for the recipient. Your transplant kidney will last longer with a living donation. You can avoid the deceased donor waiting list. Your potential for pre-dialysis transplant is there. You have more opportunity to plan for transplant, and you have greater control over your personal and professional life. If you go onto the deceased donor wait list, the wait time for a deceased donor transplant is determined by your blood type, your dialysis start date, any changes to your health status, and your level of sensitization. Your level of sensitization is determined with a blood test and refers to how likely you are to match with a donor in the general population. You may be harder to match or more sensitized because of past blood transfusions, pregnancies, transplants, or serious infections. How can you support your process to get to transplantation? There are lifestyle factors that you can manage on your own. You can optimize your health and maintain a healthy, active lifestyle, maintain a healthy weight, get optimal diabetic control, and look at smoking cessation. Once you are referred to our transplant center, please keep it informed of any new medical concerns, seeing a new healthcare provider or specialist, being admitted to a hospital, or change of address and contact numbers. And once you get to your transplant surgery, the recipient surgery takes approximately 3 to 4 hours. Your original kidneys are usually left in place where they are, and the transplanted kidney is placed low down in your abdomen near your bladder. After you are transplanted, you'll be in the hospital for approximately 5 to 7 days. You'll have very frequent assessments and testing by all your healthcare providers. You'll start your anti-rejection medications immediately, and you can expect to stay in Vancouver for up to 3 months. Once you're stable, you'll be transferred to a transplant clinic closer to your home. And in order to plan for all these things, your home team and your transplant team social workers will be involved and assist with the planning. An average kidney transplant lasts approximately 16 years. Once your transplant kidney gets toward the end of its lifespan, you may experience some symptoms of rejection. Acute rejection is when the immune system attacks the kidney. That occurs in about 10 to 15% of patients in the first year. This does not mean you will lose your kidney because it does respond well to treatment. Chronic rejection is a slow, progressive decrease in your graft function, and reasons for that are less understood. Regular follow-up with your post-transplant team and strict adherence to your medication schedule will maximize your potential for a successful journey for transplant. Thank you for listening, and we're going to go over to Ben and speak with her about her experience.
Oh, and maybe just before Ben gets started, we have a couple of questions that rolled in that maybe we can address, while we do that. So, one is you mentioned the sensitization levels on those possible events. Is that something that somebody would know how sensitized they were going into this, or how do people go about discovering what their sensitization level is?
Thanks, Mike. That's a great question. The sensitization level is something that we test for. Uh, it's not a routine test just because it can take quite a long time for the result to happen. It's quite an involved test. It takes a few weeks for that result to come back. And that is up to your provider to do with the transplant workup. If they feel that you have had some sensitizing events in your past, and if there are no sensitizing events in your past, that test may not be done before you get referred.
Perfect. Okay, and this is a good one that actually, a lot of people bring up before they've heard much about this. Um, a couple people found it surprising that the old kidneys are left in when you make a transplant, rather than replacing one of them. So any comments as to why that's the case? Otherwise, I can help with that too. But
That my only comment for that one is that often the the original kidneys still have some kind of function, and there isn't usually a reason to remove them. It is also a big surgery to remove a kidney as well. So we try to reduce as many effects as possible in that, and we'll just keep adding those kidneys in.
all right, yeah, you can just keep adding, and perfect. That's exactly right. That's exactly what I always tell my patients too. Is it might seem surprising, but actually taking the old kidney out is a much bigger surgery than putting a new one in. So if it's not causing problems, just leave it in there and add on to the list. You said you might see people with multiple transplants, and they've got 4 kidneys in there altogether. Yeah. And then you kind of went over this a bit, but is there an age cutoff, kind of like a maximum age where somebody might be considered as a transplant recipient?
There isn't. There is no definite age for cutoff in BC for transplant for kidneys, and we take things individually. We go by people's medical status and how well they're doing, and every case is a different case. We look at everybody individually.
Okay, and then just a couple more, and then we'll be able to get to Ben. There were a couple questions around, whether or not we preemptively list someone on the deceased donor transplant list here in BC or in Canada.
No, that doesn't happen. um, the no, I'm sorry, I don't have any other answer.
Yeah, and I can add to that too. And you're right.
Sure.
A couple things people might hear about that because that's a commonly done thing in the United States, for example, depending on programs. That's not really done, at least at present, here in Canada. And the way that I like to describe it to people is that the unfortunate reality of the situation is that there are more people who need kidneys than there are organs available from something like a deceased donor transplant list. So the only way that this is really equitable is those things are allocated based on how long somebody has required dialysis treatments so that it's fair to people. If we were ever in a situation where, we would love to be in a situation where there was more than that, that would be great. But right now, since the need exceeds, the amount, it's kind of the fair way to do it. I'm just going through. Oh, this is a good one. If someone goes through the process to be evaluated as a recipient, do they have to have their transplant within a certain amount of time? Or in other words, the question is kind of, does that approval expire or need to be revisited periodically?
No, your approval's not going to expire, but definitely if you are, say, on the waiting list for quite a while, that we do check-ins and we do reassessments to make sure that you're still healthy and ready for transplant along the way. Those are generally sometimes every year or two, but often people don't wait that long.
Perfect. Yeah, and the teams are always in contact, so they update each other if something big has happened, in the meantime. And then the last one, maybe I'll just take this one. There was a comment about, what are the common reasons people might be declined as a transplant recipient. There's many different reasons. I think the theme to think about there, if someone ends up being declined as a recipient, it's not that we don't want you to have a transplant. We were talking about how transplant is a better treatment choice for a lot of people. If someone's declined, it's not that we don't want you to have access to that. What the thought is that either the surgery itself or the treatments afterwards, the immune lowering medication, that the risk of that would be greater than the benefit you would get for being a transplant. And that's always the decision when it's going through something as big as a transplant surgery. It's not that we don't want everyone to have it. We would love everyone to have it. It's that for some people, the risks are actually higher than the benefits for it. Okay, so that's all the questions. Great questions everyone's got in. Thanks. And, Maggie, I peppered you. You're on the hot seat. I peppered you with questions there. But yeah, now we can turn over to Ben and hear from the actual lived experience with it. Perfect. There you are.
Great. Thanks so much, Mike and Maggie. So I'm just going to be asking Ben a few questions so we get to hear her story. So Ben, can you start us off just telling us a brief overview of your transplant experience and when it happened?
Yeah, so hi everyone. I had my transplant in February 2018. I was fortunate enough to have a great team of doctors, nurses, and social worker. They provided me with all the medical knowledge I needed to feel safe and confident enough for my sister and I to go into surgery. Prior to the surgery, there was a lot of testing and doctor's appointments that I had to go to make sure that I was healthy, that my donor would be a match. And my donor ended up being my sister, Rima.
Great. Yes, and we're going to get to hear from Rima later on. So when you knew that you needed a transplant, was there anyone that helped spread the word for you? Like, tell us a little bit about how that went in terms of conversations in your family.
Yeah, so I was lucky enough to have a lot of support from my family and friends. My mom ended up telling my immediate family, along with my uncle and aunt's family. My boss even told my coworkers, and my husband had told his side of the family.
That's great. So you had a lot of people getting the word out for you. That's excellent. And was there more than one donor who tried to be able to donate for you?
Yeah, at the end of that, I had about 5 potential donors. So I was very optimistic that at least I would have one match. And luckily enough, as you know, it ended up being Rima.
Right. Was it hard for you when other donors were unable to move ahead?
Yes. Yeah, it was.
Yeah. I'm asking you about that just because that's a pretty common experience for folks, that even if they do have a donor come forward, it doesn't mean that everybody can donate. So what really helped you get through that?
I just tried to stay positive. That's the only thing I could do, right? I didn't want to think of the alternative of going on dialysis. I just was very positive.
Right. And I'm obviously, we're all very happy that it did work out as well as it did. So tell us a little bit about what it was like for you going through the transplant in hospital for that first week and then your recovery afterwards.
Yeah, it was okay. I did okay. Like the day after that I had my transplant, I walked down the hallway to my sister's room. I ended up being in the hospital for about 5 days. And then when I came back home, every day I would try to do a little bit of walking, like around the living room area. And then the next day, like I would walk a little bit outside, like to the end of the driveway, because you're very tired. And so every day I would extend my walks. And now like I go for walks all the time, daily with my family. And yeah, I just have a lot of energy and I have my appetite back.
That's great. How long do you think it took you to feel like you had fully recovered from that and
I
were
would
really
say
feeling a lot better?
like 3 to 4 months.
Okay.
Mhm.
Okay, great. And so it sounds like your early recovery was, you were really tired, but it was okay. It wasn't too rough for you?
No, no.
Okay. Okay, great. Um, do you remember what you did to prepare sort of emotionally and physically before the transplant?
Um, it was very emotional for myself and my family, and my kids were teenagers at the time. So I made sure that I told their teachers and told their social worker at school. And obviously, I was worried about my sister's health as well. But the doctors had assured me that they do this all the time and that she would be fine. For myself, I made sure that I stayed healthy by not going out much to large gatherings, and I didn't go around anyone that was sick.
Okay. And emotionally, you were able to just sort of prepare. Was there anything
Well,
that sort of helped?
well, I had to stay strong for my kids because they were watching me. But like I said before, I just tried to stay positive.
That's great. Well, and I know in your case, you had wonderful family support around you as well.
Mhm.
Yeah. Well, is there anything that you think would be helpful for somebody who's watching this, who's, thinking that they're going to be getting a transplant at some point soon? Is there anything you think it would be helpful for them to know?
I would say just keep a positive mindset and try to stay the healthiest that you can. And also tell people your story, tell your family, tell your friends. You never know who's going to come forward to be a potential donor for you.
Those are great suggestions. Thank you so much, Ben. Is there anything else that you can think of to add?
No, I think that's it.
Okay, well, it's
There's,
really great.
I might add one, Ben. There's the question that actually someone put in the question box, and I love this question. Because we like, to hear the good, the bad, and the ugly type of thing. Anything, and now having gone through the process, anything that you kind of wish you knew before you did go through the process? If you could go back in time and talk to your previous self, anything that you would warn about or wish you knew?
Um, Looking back, I don't think so because the doctors they go through everything. So no, not really.
Fantastic. And just so everyone knows, we did not pay Ben to say that. So that she said that of her own accord just right now. That's great. You had such a good experience with it. Thanks for sharing, Ben. That's fantastic.
My pleasure.
Hi, everyone. I'm Nicole. I'm one of the Living Kidney Donor Coordinators, and today I'm going to be talking about the Living Kidney Donor Program. Some things I'll cover are how someone can donate, what the donor assessment is like. You'll be hearing about the roles of social workers in finding a living donor, as well as hearing from one of our previous donors, and then we'll take some time to do questions and answers. So what is the purpose of the Living Kidney Donor Program? We provide education and testing for potential donors. We are committed to safe outcomes, and we support the donor's decision. Really important is a pillar that we maintain privacy and confidentiality. Some principles that we follow are living donation is a voluntary decision. Donors are free from coercion. It's a donor-led process, meaning donors set the pace of their workup. And informed consent is an ongoing process throughout the workup, meaning we check in with donors at all phases of their assessment to ensure that they want to proceed with the next step. And it's important to note that donors have the right to withdraw or pause their testing at any time. Who can be a living kidney donor? Most often it's family members, friends, acquaintances, and work colleagues that step forward. Really important to note that a donor does not need to be the same blood type as their intended recipient. There's a program called the Kidney Paired Donation Program, and I'll dive into that in a few slides. But by participating in this program, you can help a loved one or friend get a kidney transplant, even if you cannot directly donate to them. So KPD, it's a Canada-wide program. It's considered when a donor is approved but cannot directly donate to their intended recipient. It can be considered for compatible pairs if there's a size or age discrepancy, and it is an option for non-directed anonymous donors, which are donors that aren't linked to a particular recipient. Some facts about the KPD program. So entering the KPD program does not guarantee a match. Some steps for the donor is they must be approved by a center in Canada. They may have to travel, and most importantly, they remain anonymous from their matched pair. There are some reasons that we would decline a donor in general, and that can include inadequate kidney function, diabetes or impaired glucose tolerance, obesity, cancer, active substance misuse, uncontrolled blood pressure, unsuitable anatomy, meaning a donor has too many arteries or veins going in or out of their kidneys, as well as psychosocial issues, coercion, and inability to give informed consent. On this slide, it goes through the living donor assessment process. So some key points are a donor must independently contact the Living Kidney Donor Program. They can do this via phone or email, and they must self-register. They will receive an information package, and they will choose to complete a health questionnaire and send that back to the donor program. They'll have a phone call with one of the nurses, and if they want to proceed, they'll move forward with laboratory and diagnostic testing. This can be arranged close to home and often includes collaboration with a family physician or primary care provider. If the baseline testing looks good, then they will be invited to come to St. Paul's or VGH, depending on where their recipient has been referred to. And at that assessment, they will meet with a donor nephrologist, a surgeon, a social worker, and a nurse. And they'll complete 2 special tests. One is called a renogram, and the other is a CT scan. If a donor is suitable to proceed, then we will discuss things like direct donation, kidney pair donation, or anonymous donation. And if they're declined, it's often because the risks for the donor are too great. With regards to surgery planning, the recipient must also be suitable and their timing is appropriate. We will take in considerations for donor timing and preference, as well as we are limited to availability of our OR and our surgical teams. This slide here goes over the statistics of donor enrollment to donation. So I would like to draw your attention to the light blue and dark blue columns. As you can see in 2023, 622 individuals registered with our program, but 35 donated. So a really important takeaway from this is we want you to note that that's 1 in 20 donors that were able to actually donate. So please do not exclude any potential donors on your own. We really encourage you to have anyone that shows any kind of interest to contact our program. We will do specific teaching. We will answer all of their questions. And we are also happy to work up multiple donors for a specific recipient. Some important information on out-of-country donors. So firstly, they must be known to the recipient. Ideally, they are blood type compatible. We can consider KPD on a case-by-case basis. They must have access to healthcare in their home country. There can be some challenges if communication barriers exist. However, we do have access to phone interpreters. A visitor's visa may be required from Immigration Canada. And donor testing is repeated once they come to Canada. And this is covered by the recipient's PHN. And although a donor may come all the way to Canada and repeat this testing, it's possible that they may still be found unsuitable. The donor surgery itself. So kidney donation surgery is known as a nephrectomy. There's 2 types of nephrectomy incisions. The first is an open nephrectomy, as seen in on the image on the left. And the second is a laparoscopic or minimally invasive surgery. This is on the right. And this type of surgery is much more common. Some of the reasons for that include much smaller incisions, therefore healing time is a lot faster. There are some surgical risks for the donor because kidney donation is a major surgery. So donors are admitted to hospital for about 2 to 3 days after donation. Complication rates are quite low, but mostly include incisional pain for about 1 to 2 weeks, nausea for about 24 to 48 hours, constipation for about 1 to 2 weeks, fatigue for 4 to 6 weeks, But it's important to note that the risk of serious complications is incredibly low at 1 to 2%, and the risk of dying as a result of the operation itself is 0.03%. So what to expect long term? Life expectancy for a living kidney donor is not reduced. Their long-term kidney function is about 70% of their pre-donation level, so there's a bit of a makeup of that loss. The risk for kidney failure later in life is, again, very low, less than 1%. There are some pregnancy considerations for women of childbearing age, meaning they should have closer follow-up recommended during pregnancy, but that's something that can be explored at their clinic assessment or with one of the nurses if they're wanting to register. And there is some long-term risk of proteinuria and higher blood pressure later in life. The living donor team will follow all living donors for life, essentially lifelong follow-up. We do recommend an annual medical exam with your primary care provider, such as your family doctor or nurse practitioner, and really important to stay on top of your blood pressure. We do recommend blood and urine testing, and those results are copied to the transplant center and reviewed by our team. If there's any concerns, we automatically follow up with the living kidney donors to ensure or explore the reasons for abnormal testing. And we can provide or transplant team consults as needed. So next up, we will hear from Jody, and she will go over the social work roles and how to find a living kidney donor.
And maybe, Jody, before you launch into it, we've got a lot of questions here, actually some really great questions. So if you don't mind saying on Nicole. So the first one, and I love this question, it's even worded exactly how I would pose it. So if there's a recipient whose donor is being worked up and that donor ultimately changes their mind and doesn't want to go through with it, is that something that the recipient finds out about, or what happens there?
Great question. So like I mentioned, one of our pillars is privacy and confidentiality. So no, we do not disclose the reason for that person choosing not to move forward.
Yeah, and even more so a lot of the time to protect the donors, there'll be an answer like it was medically unsuitable or something like this. Yeah, nobody would ever find out if you change your mind, because that's obviously a very personal thing. So yeah,
Can I
very
just add to that?
question. Please do.
So, okay, thanks, Nicole and Mike for that. I just wanted to add too, because this question comes up a lot.
Mm.
Recipients aren't going to actually know if they have any donors in workup or how many they may have in workup. And the only time they're informed of a donor is by us, is when the donor is approved and has told us, yes, they want to go ahead, and yes, they want the recipient to know. Now, of course, if you know the person, they may tell you, but I'm just saying from our program perspective, we keep all of that information private and confidential. So that can be really frustrating for recipients that they don't even know if people are working up for them.
Yeah, it's true, but it's all about protecting the donor, in this situation. That's, as Nicole said, that's priority one, Okay, and so if someone's being worked up as a donor, Nicole, what on average can they expect for the length of time? Like, what's an average turnaround time for that?
Sure. So I would say from the time of registration to completing baseline testing and having a clinic assessment and completing those 2 tests I mentioned, on average is about 3 months. So like getting the discussions out there and having people register early is a great idea.
Yes, definitely. Okay, I'm just scrolling up and down here. Oh, are they, when someone's donating, especially if there's multiple different people around, do they try to match, for example, things like age and things like that of donor and recipient?
For sure. We also take into consideration if donors are aware of other donors in workup, sometimes one person might be more ideal as a support person. So those are all things that we'll discuss as a team and discuss with each of the donors. And at the end of the day, if there is no preference within the family or friend group itself, we can also bring it to a medical decision. And you're right, Mike, we will look at things like age and other kinds of matching.
Okay, and there are a couple questions actually along the same lines. I don't remember if this was on one of the first slides actually, if we had a breakdown, but the question was, for the living donors in BC, are more of them coming direct donation, or are more of them coming through kidney parent exchange these days?
I would say most are direct if possible. I'm sorry, I don't have the statistics in front of me for the kidney paired exchange, but it is a great option. And there's a variety of reasons, as we mentioned. Linking into it, Maggie was saying earlier about sensitization. It's a big thing if a donor cannot directly donate to the recipient. That's when we'd be exploring things like kidney paired donation, as well as blood type incompatibility. Like I mentioned, if anyone shows any kind of interest, we are more than happy to work them up and explain to them all of these processes. So don't feel like you need to be finding a specific donor of a specific blood type.
Perfect. Yeah, and one of the, and actually while you're on the subject, the question came up. Someone's clearly been doing their homework, asking about blood type incompatible donation, if that's something that we do much of here in BC.
We do. There is some intricacy behind it, and it's something that we explore for all of our donors when we do their blood type testing. It's something that we really advise donors to do when they register, as we can do some really tailored teaching about what their options are. And then same thing on the recipient end for blood type incompatibility. It's a big discussion with their recipient team, and they will talk to them about risks and benefits and all the intricacies with arranging that.
Yep, perfect. Okay, I'm just looking through. You'd already addressed that one. Oh, we had this for the recipient, but same thing for the donor. Is there an age cutoff for a donor of when we might accept them?
Great question. So no, there is no specific age requirement. There are certain levels of kidney function grouped by age that we will be very closely monitoring, and there are some specific cutoffs, but age itself is not a cutoff.
Yeah, and if anything, I sometimes add to that. Unlike a lot of other procedures, it's sometimes counterintuitive, but often when we're talking about a donor, someone older is even better, because what you're trying to do when you're thinking about someone who's donating a kidney is you're really trying to predict what does the rest of their life look like. And if someone's made it to an older age, someone's made it into their later 60s, early 70s in great health, actually they've kind of passed the time when a lot of health problems tend to come up. And so in other words, you already passed the test of time. And so the donor team actually loves people who are older and wanting to donate, because if you've made it there in good health, you're doing very, very good. Oh, this is a very nuanced question that came up. It said there's a contraindication if there was abnormalities about, or multiple renal arteries or things like that. So are you able to explain why that is, or if you want, I can take that one.
I'll attempt it, then feel free to add on. So oftentimes if there's multiple blood vessels, one, it can make the surgery more complicated. And then two, there's a risk of loss of that certain part of that kidney, meaning lower kidney function for the recipient, which is something we don't want.
Yeah, bingo, exactly. Okay, just a couple more, then we'll wrap it up with this side. If someone's donating, because often they may have to take time off work. I'll actually make this a two-part question. I think I think Jody's going to cover one of the parts actually, but one of them, how long might they need to take off work? When might they be able to feel well enough to go back?
Sure. So we recommend that donors ideally plan to take 8 weeks off. 6 to 8 weeks is what we give as wiggle room, but oftentimes these individuals are very healthy individuals. They're not used to having had a large surgery like this. So really taking that time to prioritize recovery and rest is really essential.
And then for the second part, maybe Jody, you could just nod your head because I'm not going to steal your thunder, but I imagine you'll talk about in terms of income loss and things like that. For some, yeah, you're nodding your head. Okay, so I won't steal your thunder.
No, that's fine.
If people did take time off work.
That's totally fine. Yeah, though it's good to repeat things too, because this is a lot of information and it's a lot to remember. So just to add to what Nicole just said, we absolutely encourage planning to take a good 8 weeks off. That doesn't mean that you're not going to hear inconsistencies about that and read inconsistencies about other donor stories online. But because everybody recovers so differently, we really want to encourage people to take the time they need. And if you end up feeling better sooner, that's just a bonus. But we need to make sure you can actually plan to have a full 2 months off in case you actually need that much time. And many people do need that much time. Sometimes people even need a bit longer.
Okay, and then so the last one, and you hinted at this a bit, Nicole, but do people who donate and now they've got one kidney, are there any specific changes they need to make in their life afterwards? Any lifestyle changes or anything?
For sure. So really we recommend that they're seeing their family doctor or nurse practitioner annually just to have their blood pressures and so forth checked. With regards to actual activities itself, most of our donors are returning back to their regular activities or slowly returning to them around the 2-month mark. And then really we're concerned for things like combat sports or something that donors might be having to be a bit more cautious of. Wearing extra protection and just being mindful, but really there's not a lot of lifestyle changes our donors have to make.
Perfect. Okay, we've covered a great group of questions there. So yeah, now Jody, if you want to pick on with carry on with your role.
Great. Thanks, Mike and Nicole. So hi, everybody. I work in the donor program and also work with recipients as well. So I'll be talking about both sides of things, just so you can get a sense of what social workers can do to support you through this process. So on the recipient side, everybody who obviously is getting referred for a kidney transplant already has a home team involved with them, whether that's your kidney care clinic or your dialysis team. And that home team social worker still is your main social worker. So they can give you ongoing support before the transplant. They can help you with donor outreach, and we'll chat a bit more about what we mean by donor outreach if you haven't heard that before. And they work with you to support you in planning for the transplant and any traveling if you happen to live out of town. So we coordinate. Often our transplant social workers will talk with your home team social worker just to help that happen as smoothly as possible. So then when you come to clinic, you will meet with one of our transplant social workers, and their job is really to make sure that you feel like you're ready and can manage a transplant from the sort of every aspect of your life that isn't medical. Obviously, the medical side of things is getting very well looked at very thoroughly by the medical team, but the social worker is looking at the rest of your life. So do you have support in place? Do you have, if you are working, are you able to take that time off? Do you have kids that need someone else to be providing childcare, or pets that need them to be taking care of them? Whatever different aspects about your life, making sure that, mental health wise, things are going well enough for you to be able to go through this. So they will assist with all of that, and they'll ask you questions about that just to make sure that, you agree with them that this is something that you want and you can manage. And they'll help you with any planning. So again, for folks who are living out of town, it's almost like there's two different transplant experiences for local people and people who live elsewhere in BC and the Yukon. And it's a lot more stressful for people who are from out of town because they do have to plan to stay in Vancouver. The social workers will absolutely help you with that. And then while you're in Vancouver, again, for those out of town or whether you're local, the post-transplant team then takes care of what you need while you're here, and the social worker will support you through that. So they'll support you through your recovery and help with any kind of planning related to finances as well. Okay, so donor outreach. So basically, when we're talking about donor outreach, we actually heard in Bin's story, she spoke about how her mom told people that she needed a transplant, and her boss told people at work, and her husband told the people he knew. So really the idea of donor outreach is to get the word out there. And it can be really hard for you to do that yourself. So ideally you have someone else, friends and family, do it for you. And that's just the easiest way to do it. And again, that's what happened in Bin's case, and that's what happens in lots of people's cases. So there's a lot of resources available from folks who've been doing this. There's sample letters online. BC Renal and BC Transplant websites have all the information you need about that. And your social workers can really support you with that as well. And again, it's the hardest way of doing it is talking about it yourself. I often joke with people that if I'm doing some sort of fundraiser for a really good cause and need to ask somebody for $20, that feels really hard and stressful. So it's really hard to have to tell people that you need a transplant yourself. Some people are comfortable doing that, but a lot of people aren't. So ideally, you've got friends and family who are willing to put the word out for you. It doesn't have to be complicated or long. It can just be as simple as, hey, my sister is going through kidney failure and her doctor's told her she needs a transplant. If you know anybody who's interested, please give a call to St. Paul's or VGH, wherever as a patient you are. So the more sort of word that you can get out there, the better. So this is an example of one of the resources. This is a pamphlet from BC Transplant. And again, you can find this online, the Finding a Donor pamphlet and getting the word out. But just to reassure any recipients who are thinking about that and worried about the idea of somebody donating for them, as you've heard from, donors are really given the freedom to choose whether this is right for them. And it isn't right for everybody. Again, as we saw with the statistics that Nicole showed, there's a lot more people who start the process and say that they are interested in donating. There's a much bigger number than the number of people who actually end up donating. And it may be for many, many reasons, but donation isn't the right fit for everybody. It may not be the right time of life, or they may just have too much complicated things to organize in their own lives. Sometimes we have donors come forward who read something online and they didn't realize they'd have to take 2 months off, and that feels too hard to do. So there may be reasons why they can't, but that's the role of the donor team, which I'll get to in a bit, to support people. So donors, many people will come forward once they know that somebody needs a kidney. And the important thing is to get the word out so that folks who do want to help can have the opportunity to come forward. So after doing donor outreach, as we heard from Ben, it can take a while. And again, looking at the reality of the situation, there's lots of reasons why folks can't donate, or it just may not work out right away. So it's really important that you've got really good support around you. Your home team social worker can support you with that, as well as the transplant team social worker. You can provide, you or whoever's doing the donor outreach for you can provide updates if a long period of time has gone by. And it's great to focus on the positives of your efforts. So, being involved and having the person doing the outreach for you, getting the word out there, at least you're doing what you can. And in the meantime, you can just get as much support as you need to go through it while you're waiting. So switching over to the donor social worker. So the donor social worker role is to support donors in deciding whether donating is right for them. So they meet with them for an assessment. I'm the donor social worker at St. Paul's Hospital. So I meet with donors and really make sure that this is something that they're very comfortable doing and that they want to do. And we'll hear from Rima about how most folks who are coming forward really do want to do this. They really want to help whatever person they've come forward for. But in order to just make it as easy as possible for people to make the decision, we really give them the space to do that. And that's built into the whole program. That's part of the national requirements, that people are not feeling pressure and that they are free to make the decision on their own. I wanted to add here that I have a lot of donors that I've spoken with who actually have said they don't want to tell the recipient unless they know they're able to donate. So as we heard from Nicole, there's a whole series of medical tests to get through, and there may be medical reasons why someone can't donate. And sometimes donors know that their friend or family member has already had a few people come forward and be unable to donate, and they've seen their recipient be disappointed, and so they don't want to get somebody's hopes up until they know they can donate. So there may be lots of reasons why, folks choose not to say anything to the person they've come forward for. But as the social worker for the donors, I certainly help with planning for whatever they need to do to organize their life to be able to donate, and then also provide support before the surgery, planning the surgery, and then afterwards through their recovery and long-term as well. So our whole donor team is available to support donors long-term. So as I was mentioning, many donors come forward thinking this is an obvious thing to do. They report that it was an automatic decision, or a lot of people tell me it was a no-brainer. Like they said, of course, if I can do this, I want to do this. When folks have decided they want to do this, they typically are very happy to help and don't want any attention about it. the reality is people who donate a kidney to help somebody, they are heroes, and most people look at them that way, but donors don't necessarily like to see themselves that way because they just want to help somebody they care about. Most donors report that it was a very rewarding experience for them. And we only let people donate when we expect them to have a full recovery and lead normal, healthy lives. And so certainly people who donate tend to have a very, very positive experience from it and live long, healthy lives. And as we heard Mike and Nicole talking just a couple minutes ago, there are many, many donors in their 60s and 70s who've come through and donated, and we've had a lot of athletic people who return back to their very physically athletic lives, and so it doesn't limit people's lives in any way. So after donation, as I mentioned, I provide ongoing support for folks. So a lot of times I'm, helping them just figure out best timing to go back to work, or supporting them if their recovery takes a bit longer than they expect. So as we mentioned, everybody recovers slightly differently. And a lot of times, because donors are very healthy, busy people with full lives who are not used to feeling unwell, it can be really hard to go through the recovery process at the pace that the body recovers on its own. And so I'm there to support people through it and just remind folks that, we do expect that it does take a couple of months. And sometimes it can take a little bit longer for people, and that's still perfectly normal. So I provide any kind of support and counseling related to all of that. So there are some great programs in place. So the Kidney Foundation of Canada has a reimbursement program, and it varies from province to province. Those of us here in BC are the luckiest because it's the most generous of the reimbursement programs across the provinces. So it is there to really try and minimize the cost related to donating. So there are some most out-of-pocket expenses can be reimbursed through this Living Organ Donor Expense Reimbursement Program, known as LODERP. So the costs of traveling to Vancouver for those from out of town or even out of country, the cost of traveling, the cost of staying in a hotel, the cost of their support person who comes with them during the surgery week, that can get reimbursed. And then for folks who are self-employed, there's even some basically the equivalent of medical EI for people who are self-employed. Because of course, if you're self-employed, you can't get the federal employment insurance benefits, but LODERP provides a similar program for 8 weeks of lost income. We also have a great group of, and that's through the Kidney Foundation. Can't remember if I said that already, but also through the Kidney Foundation is a great group of donor mentors. So these are folks who already donated, who are happy to share their story with somebody who's thinking about it. And people can just call up to the Kidney Foundation and ask to be matched with someone, of similar demographics. So if you're a woman in your 60s and you want to talk to another woman in her 60s who's donated, you can ask for that, and then someone will give you a call. So there's really great support available for donors, and we want to make it as easy as possible for anybody who is considering doing this. Okay, so we now have our exciting second patient partner, Rima, and we get to hear about her experience donating. So Rima, can we maybe start off with telling us a bit about how you made the very big decision to donate a kidney?
Yeah, thank you so much, Jody. That was fantastic. And hi, everyone. Pleasure to be here today. That's a big question and a big decision. So the way that I put it is, it's like any other big decision. You've got your heart and then you've got your head, right? And you have to be able to balance both. For me, obviously, my heart was like, I'm gonna do this, and I'm going to be a match, and that was my mindset, and that was my heart. Of course, balanced with the head, I had to make sure that I'm healthy enough, and I'm fit mentally enough to go through this process. And so, my heart made me jump in and go through the process. And then obviously the help of all the doctors and nurses and support staff that were able to level set and provide me with all the information required that led me to ultimately make the decision that I would go through with this.
That's fantastic. Thank you. So how long did it take from that decision for you to actually get through all of the testing and evaluations?
It took me about a year. A good 12 months was the process from the time that Ben, sort of said, Rima, listen, I'm at that stage now where my function is low, and this is what I need to do now is I need to find a donor. From that stage to filling out the forms, to getting all the tests done, to meeting with all the different doctors, nurses, social workers, and then all the other tests that came along with it. And then that lovely phone call that I received. And on that day, I'll never forget that day. It was, I often say it was like winning the lottery. For me, when I got that message to say, yes, you're an absolute match, and your results came in, and you've got that green light. And it was such a fantastic moment.
That's wonderful. Well, thank you for letting us know about that 1 year timeline, because I think that's important for folks to hear, that it's really different from person to person for lots of reasons. So yes, while the average may be 3 months, it does often take donors a lot longer than that to get from start to finish. Yeah. Okay, so then tell us a little bit about what it was like preparing for the actual surgery, and what those first few days after surgery were like for you.
Yeah, preparing for the surgery, it was, I also had young daughters at home that saw their aunt sick, right? And then they saw, and then they obviously were right by my side in making this decision. So leading up to it, they were worried. They were worried about mom undergoing this surgery and not being able, not being at home for those few days that I'd be in the hospital. So there was a lot of time spent, just as Ben took the time to talk to the children's teachers and social workers. I did the same. And my children were a little bit younger than Ben's, but it was one of those things where they're seeing their aunt and their mom go into surgery. So it was quite a lot for them, I would think. So there was just making sure that everyone on the home front felt comfortable, and they had all the support required. And then from my end, obviously talking to my employer was key. Similarly, how you spoke about the support and things like that. So talking to my employer, making sure that they understood that I'm going to, be off for a number of weeks, and just making sure that it was okay. And then, just being there for Ben, and just showing that strength in positivity, and thinking, worried, but then also thinking that everything is going to be okay. Because even right before the surgery, there's some tests done to make sure that there's a that everything's a match from antibodies and everything else. So even leading up to it, there was still quite a bit of anxiousness, which I think is understandable. And then Jody, while after the surgery, I definitely felt, as I woke up, I definitely felt like, wow, what just happened? Because of course I was healthy going into this, and then waking up thinking, oh my gosh, I've never felt like this before. So that took some time. Obviously, I was out of the hospital, I think, in about 3 days. which I definitely wanted to be out of the hospital. Not that the care wasn't great. It was just, you know, the fact that being in your own home, there's nothing like it. And similar to Ben, you know, we'd talk on the phone. Luckily, we live pretty close together and or close nearby. And so we'd obviously talk on the phone every day. We'd exchange little tidbits about, you know, what did you do today, and how much, you know, how much did you walk down the driveway today, or you know, all those types of things. So we tried to just as going into it, we had this a strong relationship. Obviously, coming out of it, we had this very shared experience that is that we share those memories as well.
That's great. Well, you know, I often warn donors that, like you just said, you know, you're going into this feeling great and you're going to wake up feeling worse. And with the recipient, it's the reverse. Usually recipients are coming into this feeling terrible and often wake up feeling better. And so we heard that, you know, Ben was able to walk to your room the day after. And I'm just curious, were you feeling pretty terrible then?
Yes, I was. But you know, seeing Ben and the courageousness of her walking into my room, I thought, oh my gosh, like how come I don't feel that way. But just seeing her, you know, she had the rosy cheeks back. I mean, it was again such a remarkable moment that I won't forget. But yeah, I wasn't feeling that great.
Yeah, I mean that is why you were doing it in the first place, of course, but it is good for folks to realize that it is difficult, and there's definitely quite a bit of pain and discomfort, and it can be quite a shock to the system, can't it?
Absolutely.
Yes. Well, so tell us a little bit more about your sort of longer term recovery. How long do you think it took till you felt like you were really recovered?
It definitely was that 8-week sort of mark for me. In fact, I think I actually took another couple of weeks, so I ended up going about 10 weeks in terms of returning back to work. But and then by that point, you know, I was feeling fine. I just felt like I needed that extra little bit. But you know, but again, working with the team and everything else, it made me feel like, okay, I think I could afford another couple of weeks to just give me that extra bit of a bit of more time to feel great. And so yeah, so about the 8 to 10 week mark for me.
Okay, that's great to hear about that. Thank you. So did you have a chance? I forgot to ask you this question. Did you have a chance to talk to anybody about donating before you donated?
I didn't. I didn't. And I'm trying to remember why, and perhaps maybe it was I just I didn't know about the resources available, like the mentorship program. But yeah, I personally didn't, and to be quite honest, you know, now in hindsight, I don't think it would have changed the outcome or changed my decision, but I can see how important it is, and therefore why I'm participating in webinars such as this, in terms of just making sure that folks that require more information, that they're able to reach out and speak to donors that have gone through the process.
That's great. Yeah. I think our program didn't exist when you went through. The donor mentor program wasn't created yet. But it's fantastic that you're sharing your story here so people can hear your lived experience of this. That's so great. Well, is there anything else you think would be helpful for donors to think about? Or like somebody asked earlier, something you wished you had known ahead of time?
Yeah, I mean, as you had on one of your slides, Jody, this for me, you know, is truly a gift. You know, the life I lead now wouldn't be the same without that you know, anchored in purpose, right? I mean, it's like seeing my sister live such a full life, and being able to be a part of that has been such has weighed so heavily on not only me, my children, my family. It's been such a rewarding part of my life, and is now even moving forward, right? It's just anybody that wants to ask and hear our stories, we will be the first to share our life experience of this amazing journey that we've been on and we continue to be on. So thank you for allowing us to share our stories here today.
Well, thank you so much. It's a beautiful story and such a beautiful experience. And so any final thoughts or anything, tips for any potential donors that you can think of?
I would say it's a personal decision for sure. One that is a big decision, but there's so many resources out there, and great great experiences. But you know, you've got the medical facts behind you as far as the doctors are there to aid in that process as well. So that's all I would say.
Thank you so much, Rima. It's wonderful to hear about your experience, and I'm so glad you and Ben are both doing so wonderfully.
Thank you.
Okay, so it looks like we get into question time, but yeah, I just want to echo, what Jody just said. Rima, you and Ben both, thank you for sharing. And what I want to use the exact same words. What a beautiful story the two of you have, and I'm so grateful that you could share this with everybody on the call. You really just summarized it so perfectly and beautifully. Okay, so yes, I see cameras are back on because we got some questions. People can be on the hot seat here. Some good questions here. So Jody, for your part, you had talked about some of the examples of how people do some donor outreach and things like that. One of the questions came up is, are there any examples available about things like letters people have written, social media posts, this type of thing that we can point people towards?
Absolutely. Thanks. It's a great question. Yes, the BC Renal Agency and BC Transplant both have on their websites sample letters in English, Punjabi, and Chinese. And so those are examples of what you can say, and that can either be put into an email format, a social media post, any kind of letter. So absolutely, those resources are there and available. So you can check those websites out. That's the BC Renal and BC Transplant. And you can also ask your social workers to help you with all of that.
Perfect. And perfect plug for our websites. Great. It's like a loaded question. Okay, there were a couple around donating that I think is actually, really relevant because it got mentioned a bit, Nicole, during your part about how it's a very rare occurrence. But there were some specific questions about, what happens if somebody donates and then they end up with real trouble with their kidney function or even, kidney failure themselves. What happens in that situation?
Sure. Very great concern. So like I mentioned, we do recommend our donors have annual testing. So if we see these things, we want to catch them early, making sure that patients are getting education on it. And then if the kidney does, or if their solitary kidney does fail, a previous donor does get kind of a priority status to receive a donor kidney if they need one.
Yeah, perfect. It's a very rare occurrence. It's only happened a couple of times in BC. But not just priority status, just to be clear, that person goes right up to the top of the list. So they would be, very quickly receive a transplant.
And can I just add, this would be the one case where we would actually transplant somebody before they're even on dialysis. So I know that question came up earlier, and that is something that we do for previous living donors. They do not need to wait till they're on dialysis to be waitlisted for a deceased donor kidney if they've previously donated.
Absolutely. Yeah. Thanks. Yeah. And there are a couple of very rare other medical situations where that might happen as well. But yeah, by and large. Yes. Yeah. Thank you, Leah. Perfect. Okay. And then there were a couple around, kidney function, and maybe I'll take this one, because there was not just, that was the situation where the donor actually reaches kidney failure. but what about a changed kidney function after donating? I often, this is one of the reasons that our donors are followed, for years, just like for the rest of their life, just like Nicole mentioned. I often warn people if I see some of the donors afterwards as well and say, well, you often get flagged as having kidney disease, as chronic kidney disease based on the test. And that's just because the test automatically spits out a level that's called normal, which you have to remember is for somebody with 2 normal working kidneys. So after you've given up 50% of your kidney function, it's normal for that to drop down. That's a very different thing than saying that's kidney disease. And that's what we really like to emphasize with people. And it is, but that's why, so it's almost, think of it like you'll have a new normal for you, your new normal, and then after that, it'll be followed to make sure there's not something changing. So that's really what the theory is there. There was a question kind of related, again, I'll take this one, but around, what if there happens to be a hereditary type of kidney disease and now somebody donates, and is that going to be a risk? This is a smaller proportion of kidney diseases we see, but it is a real consideration for some certain types of diseases. We do see genetic kidney diseases, things like polycystic kidney disease and others. And just, to summarize it, say the donor team won't let someone donate until they are convinced that that is not the case, including when needed genetic testing gets used quite a bit to make sure that that specific thing would not be a risk. Okay, so there's a few other things going through here. Okay, one, and we kind of touched on it a bit, but this might actually be a good one, from the recipient side. So maybe just, because it is worth repeating, if the recipient is wondering where things are at in their process, if they knew they had donors being worked up, we did talk about protecting confidentiality and things like that. But let's say the donors, or the recipient's at a point where they need to decide, are they going to be going on to dialysis, or is their transplant going to come through in time? Are they able to call over to the transplant team and say, hey, where does it look like things are at? Or do they get some kind of update along those lines? And how much can we say?
That's a great question. We do stick with the pillar of confidentiality with the donor. If they do not have an approved donor, we cannot give that information out about where that workup is at, because there are so many things that can pause or delay a workup, and that's just not something that we can give to the recipient. But there's a lot of work that goes on in the background on the workup for the recipient, and if there's a timing issue of dialysis versus pre and having a transplant, then all of the team comes together and we make these decisions in real time while we're trying to figure out these timing things. So unfortunately, the protection for the donor is definitely there, and we can't give out that information, but we give as much information as we can.
Yeah, I think that's a really good answer. And maybe the other side I can put there is from the care provider side, as you just said, there is some talk behind the scenes. And although I can tell you, even as a physician, I won't get a specific 100% answer, but we will get enough information for us to be able to plan. So we'll kind of know, okay, which road does it look like we're going down, so that the person who's waiting isn't kind of stuck in the lurch saying, okay, my transplant's not ready, but I don't know if I need to go on dialysis. We will be able, between talking to the two teams, make sure that we've got a plan, a safe plan in place, for that person. It's a really good question. Okay, there are a couple questions around second transplant. So this is a really good question here. So let's say, so we'll go into two. Let's say the first one was, if somebody has a transplant that ultimately then fails, is there some amount of time that they need to wait before they can go on? Or can they actually, just like we talked about people looking for transplants before they need dialysis, can they start, looking early as well to see if there's a donor and try to get one in short order again?
Is this one for me?
I think so. Yes. Yeah.
Okay. Okay, so when we have a recipient, we're generally notified by the post-transplant team that there's a possible person that needs a second transplant, and that person gets referred as soon as possible to us. And the testing and everything is done as soon as possible. And that's generally coordinated by the post-transplant team because they'll be seeing those signs right away. And at St. Paul's, our nephrologists are also pre and post nephrologists. So they're seeing the post-transplant patients that they're going to be seeing again in the pre-transplant clinic.
Yeah, I think, and then, yeah, I might just add on to that Maggie, depending on what the situation is, there might be some situations where if there's a disease that's active, for example, there might need to be a bit of waiting time in between. But, the message I always like to give people, it never hurts if you to do that outreach. And then ultimately, whenever the time is right, then, you can go ahead and start moving forward with it. Okay, I'm just looking through, some of these are very good questions. So one of them, you talked a little bit about the recovery and support people, but one person was asking, well, what if they, kind of live alone and things like this? Because you talked a bit about for both the donor and the recipient, and maybe we'll ask from both sides, the donor and recipient side, that people leave hospital, pretty quickly, which is right. That's the goal. People recover better at home. But is that a concern if someone lives on their own? Will they be able to recover by themselves? Or are they going to need to find help? What do we tend to suggest to people? It's a really good question.
That's an excellent question. I'm happy to take that one. We absolutely strongly encourage support people in place. We really want everybody to have the best recovery possible and have things go as smoothly as possible. And these are major surgeries on both sides. There's different considerations for the donor. Their follow-up is pretty minimal, but if they feel pretty rough, and we heard from Ben that she did, from Rima, that she did feel pretty rough at first. So it's really ideal to have somebody around who can just support you, make sure you've got food. For both sides, people can't lift anything for 6 weeks. So you need folks around who can, lift groceries and laundry and do house cleaning. And again, it's just going to give you a better recovery if you have support around. So the social worker will definitely talk with you about that. And for the recipient, there's very intensive post-transplant follow-up. So there's twice weekly post-transplant clinics that are all morning on Mondays and Thursdays. And occasionally there's even going to be extra appointments in between. And it's really essential that you have somebody who can bring you back and forth to those appointments. Sometimes it's the most challenging for the folks who live in the Fraser Valley, which is, a half hour or 45 minutes or even an hour away from St. Paul's Hospital because the public transit options don't work. And so it's really essential to have friends or family who can drive you back and forth for the first little while folks are recovering.
Yeah, that's a good way of summarizing, Jody. And I often tell my patients, and yeah, my practice is in Surrey, like you said, we're in that zone where they have to drive. That for the first little while, it's like a job. It's kind of, this is your job, is going to the appointments and getting the tests, and just to not to make it sound bad, because obviously it's a job you want to have. It's a good thing, but just to think about, yeah, it is quite a lot that you'll be back and forth. It is a time commitment. It will
It's
be
a very big. Sorry.
Yeah. I was gonna say, it'll be the main thing in your life around the time that the transplant.
Absolutely. It's a very big time commitment for that follow-up for those first couple of months. And then gradually as people recover, the follow-up gets less, but there's a lot of medication changes those first few months. People may feel side effects from the medication, so they may not be feeling great. So it's really important to have support to get through that intensive time right after transplant.
Okay, so this one, yeah, it didn't come up yet, but this is good. This is a question about, I think, just to reword it, it's about kidney paired exchange. Because the question was basically, if one of them goes through, do the people down the chain find out about that and then get to make a decision about if they want to go through with the transplant afterwards, or does everything all happen at once?
So when a kidney paired exchange chain is published, the chain itself is considered a whole. Ideally, these surgeries are happening within 1 month to, or sorry, 1 week to 1 month of each other. And no, there is no choice in that. Ideally, if a pair is entering the kidney paired exchange, they are committing to moving forward with the surgery if they make a match.
Yeah, so it doesn't, not that anyone would do this, but it doesn't happen that one person gets their transplant, says, okay, thanks, we're out, and then leaves, people in the lurch. It's a good question because you could see how you might be worried about that if it's someone you never met, but there's very much processes in place, so you can't just take the kidney and run, so to speak, from the chain. Yeah. Okay.
Can I just
and
add one little thing to
please,
that?
yeah.
I know, Nicole, you were just saying that they happen typically within 1 week to 1 month, but I also wanted to add that we see a lot of them happening even within the same week. So they're attached to each other, and everybody does everything across Canada to schedule them as close together as possible. So it all happens really quickly and smoothly.
Yeah, exactly. Okay. The couple of others, I'm just checking. One, it's come up a few times, just to reiterate that question about preemptive transplantations from the deceased donor transplant list. Again, just to reiterate, that's only for very, very rare exceptional circumstances, at least in the current state. I know it comes up a lot because, especially in the American system, which is where a lot of people find their, online information from, that happens, but it's a totally different system there. And frankly, our system here is based on equity, not, other considerations as theirs in. And that's the real reason that it's the case. Just because the need outmatches the availability of the kidneys, the only equitable way to kind of do this outside of very rare situations is for it to be done based on dialysis. There were a few other items around things like, complications for the donor, like actual operative complications, things like heart attacks and all that type of stuff. And I'll just say this is why the donor goes through so much testing, to make sure that they're not at undue risk. The phrase we often like to use is that the donor will get more tests than the recipient, and that's to make sure that since they're the one taking, this extra risk, we want to make sure that's not any higher.
That also ties into timing. So when I gave the example of the 3 months, that's for a very straightforward donor. If any individual has any complexity in their testing, we investigate that thoroughly, and we'll always reevaluate if a donor, or throughout the donor's workup, whether or not they want to move forward with this, before we can safely say you are approved for transplantation.
Yeah, exactly. There can be a lot of testing. It's both, it's sometimes a selling point. We actually told the donors that this is the most thorough medical workup you will ever get in your life. If there's something there, it will be found, because this is the most thorough workup you'll ever receive.
Absolutely. And just to add to that too, just to reassure folks, if the medical team thinks that something bad is going to happen and some medical complication is going to happen, if we expect that or think that, we don't let people donate. So we turn people down if we think the risk is, if we think there's a good risk that something is going to go wrong and it won't be as safe as possible for people. So that's another reason why those numbers are so different between those who come forward and those who actually donate, because we don't let people donate if we don't think it's going to be as safe as possible, and if we don't think they're going to have a great recovery and get back to living their normal lives.
Yeah. Okay, this is a really good question. If someone's thinking to donate, and maybe I'll make it a two-part question. One is their employer allowed to refuse them taking the time off? And maybe a related thing is anything we can do to help out if someone's trying to donate but having difficulty with an employer?
Those are great questions. In my almost 10 years in the program, I don't think I've ever heard of an employer refusing to allow somebody to take time off, although sometimes people haven't been in a job long enough where they feel like they can ask if they're newly in a job. So absolutely, I've gotten involved in helping communicate with donor employers, providing a letter, explaining the situation, or having a conversation. So it's much more common, I think, that employers are very happy to support people. But certainly if somebody wants to do this and their employer is not being supportive, you can certainly contact the donor social worker. If it's, it would be me if it's at St. Paul's, or if it's at VGH, you can contact them and ask them for help around that. And on that note, I wanted to just put a plug out for the Circle of Excellence while we're chatting about that. So the Circle of Excellence is a program to encourage employers to support their employees in donating. And it's a partnership between the Kidney Foundation of Canada, the American Society of Transplant, and the Canadian Society of Transplant. And it really, the BC government has just recently announced that they will now support all of their BC government employees to take paid time off to donate. So it's really just a great way to support folks, the rare few people who actually want to do this. And it is very rare. I recently learned a statistic that it's approximately 600 people in Canada donate a year. So that's a tiny number out of our entire population. So most employers are certainly willing to support folks doing this. And even if there's no benefits available through work, people can get medical EI to do this. You do qualify for medical employment insurance benefits to donate.
Yeah, and one of the themes there, because it sometimes, comes up, obviously, it's not like we can be paying donors for doing this, but the real theme when it comes to things like, the Circle of Excellence and low DERP and things like that is that somebody who's doing the amazing thing of donating a kidney should not also be taking a direct financial hit for doing that. And that's really what we're trying to remedy. Yes, it's not to pay somebody, with all these various programs, but they shouldn't be losing money and donating a kidney at the same time. That's just, really unfair for someone who's doing such an amazing thing.
Exactly. We don't want people also donating money.
Yeah, exactly.
Yes, but we also, on the flip side too, we also don't want finances to be a barrier, and it's a really reasonable thing that people who are working for a living need to have their income covered while they're off, because most people depend on their income to be paying their living expenses. So that's what these programs are about as well.
Okay, maybe this one I'll answer while I'm putting up a couple of slides here, and just please do get any last minute questions in if you like. There was a question around, are there ever times where somebody's approved but then ultimately can't get a transplant? And that really just comes down to if some medical situation has changed or something else happens before then. So in other words, it's not like if someone's approved, all of a sudden they'll show up one day and say, actually, we changed our mind. We don't want to, we don't think you're an appropriate candidate for a kidney. That is what all this assessment is for. So once you're approved unless something new comes up before that. Okay, but yeah, so if people have any last minute questions, do get them in. Otherwise, I just wanted to put up these last few things about some of the resources that we've already heard about, through the talk. So here's the one that this came a few times about our BC Renal website, where these informations are, both what the process looks like, and that's where you'll find those resources Jody was talking about earlier, like the letters and social media, examples and things like that, which is great. We heard a couple times about the Kidney Foundation and their peer support program, and here's the exact information for it there. And this one, Christina put this in, so thank you. Oops. Christina put this in the chat, so thank you for doing that. And I was scrambling to get a slide of it on after you put that there. This is brand spanking new, an initiative that the Kidney Foundation is doing, which is just so awesome. Where there's actually going to be a series of online sessions specifically for people who are going through the process of looking for a donor. And you can see the titles here, right? Like very, very relevant topics here, like how do I share my story using social media, and, managing obstacles that come up along the way, in case that you're not immediately successful. I'll leave that on the screen for a second because there's actually a QR code there if this is something you're interested in. We put that up there. But yeah, this is a fantastic program. So glad that to have this available now. And then otherwise, we just love to hear any feedback after the session. So those are our last little housekeeping thing, that you will get an email that both sends links to all the resources relevant, but also importantly, a feedback little survey, because we would always love to hear if you have any other feedback about these sessions and how we can make them better as time goes on. Otherwise, I just want to thank, this is a fantastic session, huge amount of participants, huge amount of questions, so really interactive session. So thanks everyone for that. I really want to take the time to thank all of our presenters here. Again, I can't say enough, very appropriate, as you saw, what a wonderful panel of people we had here, especially here on talking about kidney donation on International Women's Day. What a beautiful session we had. And again, so I want to thank everybody. We have our healthcare providers, which is fantastic. And again, Ben and Rima sharing the personal story. That's always just so beautiful and such a nice touch. So thank you for doing that. I want to also thank, we never see them, but behind the scenes, there's a whole group of people at BC Reno who set this up, especially Janet and Alexis. They put a huge amount of work into facilitating these. So thank you for doing that as well. And of course, thanks to all of you who attended. And we hope to see you again for another session in the future. Okay, but thanks everyone for such a great session.